Good morning to all of you. Chief guest, Sri Dinesh Bhai Makwana ji, Honorable Member of Parliament from Ahmedabad West Zone. Guest of honor, Sri Amul Bhai Bhatt ji, Honorable MLA from Meghaninagar. Respected guest of honor, Dr. Rajiv Bell, Director General ICMR and Secretary, Department of Health Research, Government of India. Dr. Rajnaran Tiwari, Director, ICMR-National Institute of Research in Environmental Health, Bhopal. And co-organizer of CliCON OEH 2025. Dr. Vikash Kapil from Emory University, USA. Dr. Ankit Sheth, scientist, ICMR-NIOH and the organizing secretary of CliCON OEH 2025. The dignitaries in the auditorium, invited speakers and expert researchers from India and abroad, delegates, friends, colleagues, students and fellows. It's a proud moment for ICMR-National Institute of Occupational Health, Ahmedabad, and a privilege for me to welcome you all on behalf of this institute to the inaugural ceremony of CliCON OEH 2025, the Indo-US conference on climate change impact on occupational and environmental health that marks the beginning of the celebration of the Diamond Jubilee year of ICMR-NIOH Ahmedabad. Climate change is an unprecedented challenge to the global community with immense human, social, environmental, and economic costs. Recent data from World Economic Forum shows that the world will have to bear a burden of additional 14.5 million deaths and 12.5 trillion economic losses by 2050 if we do not act now to restrain the climate change impact. Global warming caused by greenhouse gas emissions and leading to intensifying heat waves, increasing air, water and soil pollution from fossil fuels and chemicals, frequent extreme weather events, and emergent spread and changing patterns of vector-borne and other infectious diseases have posed enormous threat to the global public health. While no one is exempt from this, communities living in the lower middle-income countries and certain population groups like the poor and marginalized, women, children, and the elderly, and outdoor and emergency workers are more at risk. WHO in its COP29 special report has rightly made health as the argument for climate action and called for building capacity towards global research agenda, adopting a health in all policies approach in national and regional climate policies, strategies and plans. It also urged for a health-centered intersectorial cooperation guided by the One Health approach, acknowledging the interlinking of human, animal and environmental health for climate change response. There is an urgent need to build partnership to contribute to building resilience by providing data and tools to address climate-driven health risks. Referring to occupational health, more than 70% of the global workforce are likely to be exposed to climate change-related health hazards, which the existing occupational safety and health protections are struggling to cope up with. International Labour Organization recently estimated that more than 2.4 billion out of a global workforce of 3.4 billion will be exposed to excessive heat at some point during their work, which is 65 to 70% increase since the year 2000 in terms of the share of global workforce. Heat-related occupational diseases already causing over 22 million injuries, leading to nearly 19,000 deaths per year and over 2 million disability-associated life years. Over and above this, a staggering number of 26.2 million people are living with chronic kidney disease due to work-related heat exposure around the world. Not to mention that the impact of climate change on workers goes much beyond exposure to heat only, but rather to a cocktail of hazards leading to a range of dangerous health outcomes. It is imperative that we pay immediate attention to the global warming and climate change and make occupational safety and health considerations central to our climate change response, both in policies and in action. I express my sincere gratitude to the Honorable Member of Parliament, Sri Dinesh Bhai Makwana ji, Honorable MLA, Sri Amul Bhai Bhatt ji, and the respected DG, ICMR and Secretary DHR, Dr. Rajiv Bell, for making it to this conference, to this inaugural session, despite their very, very busy schedule. I am extremely grateful to all the dignitaries and guests who have assembled here to impart a grand opening to this conference. I profusely thank to the speakers and delegates who have traveled all the way from the US and different parts of the country to make the conference an august gathering of researchers, academics, and healthcare professionals. And last but not the least, I must thank the team of NIOH whose tireless work for several months now, despite multiple odds, has made this conference possible. At the end, I have a small regret. We planned this meeting almost a year back in collaboration with our US colleagues from Center for Disease Control, Atlanta, and National Institute of Environmental Health Sciences, which is part of National Institute of Health, USA. Unfortunately, due to recent turn of events, the CDC and NIOH colleagues had to withdraw themselves from the organization of the conference, although we were never deprived of necessary suggestions and scientific support from their end. I'm sure that this will not dampen our enthusiasm, and working together, we would make the conference a grand success, not only for cutting-edge scientific discourses, but also policy discussions and drawing out action plans. Thank you all again, and welcome to CliCON OEH 2025.